The Clinical Compass is sponsored in part by True North Medical Care.
Hello everyone, and welcome to the Clinical Compass, where we navigate healthcare through truth and expertise. My name is Chad Stencil, and I'm a family nurse practitioner and also the host of the Clinical Compass. Today we're going to be discussing women's health, and we have a very special guest. Her name is Sue Goehl-Manolis, and she is a nurse practitioner that specializes in infertility and also women's health. Thank you, Sue. I appreciate you coming on the show.
Thank you, Chad. It's great to be here.
Why don't you tell our viewers a little bit about yourself and what you do in your place of business?
I am a women's health nurse practitioner, and I founded a practice for male and female infertility, as well as perimenopause and menopause health a few years ago. So my background is reproductive health and OBGYN, and in working in those clinics, I found that the male side was very much forgotten, and this way I can encompass both male and female fertility, as well as perimenopause and menopause hormone health.
That's awesome. And where's your office located at?
My practice is in Eden Prairie,
Awesome.
Minnesota.
So let's talk to our viewers a little bit about women's health. As a nurse practitioner, I get trained in women's health as well, but it's not really a topic that's on the forefront, right? Mm-hmm. And it kind of gets forgotten. And so, I think that's why it's so important to talk to our viewers today about women's health. And I think we should start with prevention. Mm-hmm. I think in the United States, we're very reactionary. We do a lot of reactive medicine, like you have a problem, come see me. But I, as a practitioner, believe that being proactive in prevention medicine is the way to go. So can you talk a little bit about what types of tests or what types of things women should do for prevention?
Mm-hmm. I completely agree with you. Prevention is super important, and women often put themselves last. So
True.
It's at the bottom of the list unless something is very imminent or catastrophic. So routine care to catch a lot of these issues ahead of time is super smart. And whether that's going for an annual exam at a family practice clinic or a OBGYN clinic, wherever you feel more comfortable is great. And at that annual exam, physical exam, pap smear, breast exam, depending upon age, would include a mammogram, a DEXA scan for bone health, pap smear, talking about contraception if needed, natural family planning or fertility issues. All kinds of things come up at those type of visits. Not just yep, great, everything's perfectly healthy. Could be, but it also could be much further down into all kinds of different paths of how do I achieve whatever the goal may be.
Sure. And, a lot of those tests that you talked about are great, right? We should be checking a DEXA scan. Bone health is super important for women. But also blood pressure, right? The silent killer. Cholesterol levels, A1C, which checks your blood sugar. Those types of things are important as well, right?
Yes, and vitamin D.
And vitamin D. I'm glad you brought that up. None of us get enough vitamin D in the Midwest, right?
Yeah.
Okay.
Roughly 80% of us are deficient, so.
Yeah. No, I'm glad you brought up vitamin D. It's such a huge part in the mammograms and just all of these things because, and correct me if I'm wrong, if I talk out of turn, a lot of these things are missed, right? A lot of these things, fall through the cracks or just don't get thought of until we find a problem and then we're like, oh, we should have done X, Y, or Z. Do you see that in your practice or do you see it with your patients?
Yeah, definitely see that where, oh yeah, I had my physical. Okay, well, what was done? What was said? What tests did you have? What labs can you share? And oftentimes there aren't labs, or maybe just a hemoglobin, or something not delving into A1C, vitamin D, the things that really have that ripple effect and are prevention.
Our prevention. Yeah, I think prevention in medicine in general is super important, but women's health, it's super, super important. What other things would you discuss with patients as far as women's health? Or I should say, where can women go to get these types of tests? Do they have to see a family doctor? Should they see a women's health expert like yourself? Should they go to OBGYN? Can you speak to a little bit of that? Because I think people really want to know where they should go to get some of this care.
Yeah, and that's a great question, and it's very individualized. Some patients are just, I want to get in and get out. I don't care if I see male or female. I don't care this or that. And others really want that personalized care, want a specific type of provider, maybe have a topic that they're embarrassed to talk about and don't know how they would bring it up. So any of those that you mentioned could be great options. It's if that's where that person feels most comfortable. And I say so often there are so many fish in the sea. We don't have to stick with the same provider if we don't feel comfortable there. A pap smear should not be painful. Talking about birth control options, talking about things that may be embarrassing to you, it's so commonplace to us. And having a provider where you feel comfortable is what matters. So it could be primary care, could be OBGYN, could be a physician, could be a PA, could be a nurse practitioner. It's where you feel comfortable.
I'm glad you brought that up because we've brought that up on other episodes. You do not have to stick with the same doctor, same nurse practitioner, same physician's assistant. If you don't feel comfortable talking about things, especially things that are important, women's health topics, things that are personal, you can definitely find somebody else that you feel more comfortable with and that you feel more familiar with, or those types of things. In your practice, are you ordering DEXA scans? That was one thing that we brought up, and that's one thing I'm very passionate about is knowing bone health so we can prevent those hip fractures and those different types of back fractures and stuff. Are you ordering those routinely, or how are you doing those types of testing?
I do. With my perimenopause and menopause patients, I bring it up every patient because I do think it's super important. We start losing bone very early, as I'm sure you know too. And the guidelines say to screen at 65.
Okay.
And by 65, the damage is already done.
Yeah.
So what can we do to be helping either maintain or build bone and at those earlier stages? So yes, either just the traditional DEXA or the DEXA with body composition that also gives the body fat analysis and skeletal muscle and visceral fat and more deep down to kind of give that personalized goal of, oh, I should be gaining here, I should be losing here, this is where I'm at now, this could be a motivator to help me. So yes, bone and other as well. I think it's super important, like you.
Yeah, okay. No, and I do the same thing. I order DEXA scans because it's one of those tests that, again, for some reason, gets missed, right? It's not talked about enough, or maybe there's some confusion about how to order it, how to read it, right? Those types of different things. I know our viewers always appreciate when we talk about DEXA scans, and a lot of this prevention stuff we're talking about is covered by insurance, correct?
It can be, and it can be as low as around $100 out of pocket.
Okay.
And you can just self-order it.
Gotcha. Because that's always something super important is my insurance going to cover this? And for our viewers, a lot of times we want to make sure that you understand that insurance does cover a lot of this preventive medicine, DEXA scan, mammograms. One of the things we haven't talked about is colonoscopies, right? Those are super important. Can you touch just a little bit for women on colonoscopies?
Yeah, I agree. Super important screening and as prevention, as diagnostic, it's kind of all of that wrapped in one. And they'll guide you. How often do you need to go back?
Sure, right.
And that's another, you can self-order that. Don't have to have an order from your provider to actually schedule your colonoscopy.
We're going to shift a little bit here and talk about heart disease in women because it's different, right?
Absolutely.
So my experience, I worked in cardiology, but I want you to speak on this as well. Women don't act or respond the same when they're having heart attacks. Can you talk a little bit about that?
Yeah, it's the traditional is that grabbing your chest like you just did in mentioning it. And for women, that is not how we typically present. It is jaw pain, it's fatigue, it's nausea, it's things that we as women so frequently just blow that off and think, oh, I just didn't sleep well, or oh, something else. But yes, very different symptomology.
Yeah,
What's your experience with that?
My experience has been the same way. Very, very rarely do I have or had a patient where they come in and say, I have horrible chest pain, especially a female, right? I have horrible chest pain. Now, that can happen. However, it is the female that comes in that says, hey, Chad, I've been extremely tired and exhausted lately. I can't move around because I get short of breath, or I'm just so exhausted I have to take a nap. Those are red flag warning symptoms for me, and I'm sure for you as well. And that's just one of those things where we have to pay attention to this, right? So if you're feeling exhausted, if you're feeling jaw pain, even tongue pain or ear pain, different types of symptoms that you don't normally have, those are things that you need to tell a provider, any provider, and then we need to do further testing like EKGs, blood tests, those types of things just to make sure something is not going on, correct?
Right. Yeah, rule it in, rule it out.
Rule it in and rule it out.
Figure out what it is.
Yeah. We're going to take a short break, and we'll be back in just a few minutes.
Beth, can we rent out the studio?
There's so much room for activities in there.
People could host meetings.
They could use the green screen.
They could do photo shoots.
You guys are the professionals, if that's what you want to do.
So?
Yeah, just go for it.
You're not gonna regret this. Look at all this floor space.
At True North Medical Care, care is in the name. True North is proud to provide personalized, evidence-based medical care designed to help you feel your best. Offering in-person appointments in Edina and virtual visits to meet you wherever you're at. True North Medical Care and family nurse practitioner Chad Stenzel are here to help you empower your healthcare journey. More information can be found at truenorthmedicalcare.org. Town Square Television is your community TV station. We are a 501c3 nonprofit organization.
I want to be a farmer when I grow up.
We partner with volunteers and organizations to provide truly local television,
He's got a way and he'll walk his way into the end zone.
including high school sports,
Big time play right there.
music, arts,
Okay, next.
local government, news and politics,
Welcome to the Mendota Days Parade.
and coverage of community activities and events.
The freedom of speech, the right to assemble peacefully. We have all these rights.
Our mission is to connect all residents of Northern Dakota County with our community by producing local video content that is easily accessible
And we get served donuts.
and empowering people to share their own stories using video. To continue our important work and mission, we need your help. Our funding from cable franchise fees has declined significantly. You can help us by donating, becoming a member, or volunteering. To make a tax-deductible donation, visit townsquare.tv/donate. To support us by becoming a member, go to townsquare.tv/members-creators to sign up and learn more about the benefits of being a member. To be added to our list of volunteers and see upcoming volunteer opportunities, visit townsquare.tv/volunteer. With your help, we can continue engaging and connecting all through local community television.
Hello, everyone, and welcome back. Before we went to break, we were talking about women's health and prevention and heart disease. We're going to shift our focus a little bit now and talk about how women's healthcare changes with age. So Sue, you're the expert in this. Let's tell our viewers a little bit about, one, how women's health changes with age, and then we'll get into the topic of perimenopause, and we can, from there we can segue to menopause and other treatment modalities down the road.
Yeah, so women's health with age, if we go all the way back to puberty, a menstrual cycle is considered a vital sign. So that tells us so much information about other things that could be going on in the body. So if we fast forward through puberty, through childbearing years, and then look into perimenopause, menopause, and beyond, so much of that is dependent on what our estrogen levels are doing and what's impacting those. And that guides so many things. Are we going to have difficulty with fertility or are we not? Are we going to have all kinds of issues from there? So if we start to dial in on perimenopause, that definition is when we start to have some estrogen changes, and those can happen up to 10 years or even more before we hit menopause. Which menopause, by definition, is a day in our lifetime. It's the day we've gone 1 full year without a period. So perimenopause can start anytime before that happens. Menopause in our country is around age 51. So we can be seeing women in mid-40s, early 40s, sometimes even in late 30s, start to have these menstrual changes, symptom changes that are so commonly written off as something else, and not even looking at perimenopause and estrogen being a part of that.
A part of that. So if somebody comes into your office, what type of symptoms do you generally see when they're already hitting some of those perimenopause type symptoms, either in their 30s, late 30s, or early 40s? What is the most common symptom? But speak to like a lot of the symptoms that kind of show up.
Yeah, most people think, oh, it's got to be the night sweats. It's got to be the hot flashes. It has to be vaginal dryness. It has to be these very stereotypic symptoms. And in reality, that may be happening, but what's happening oftentimes before that is I don't feel like myself anymore. I have brain fog. I can't remember things. I am not sleeping well. I'm irritable with my children. I can't handle all the work projects. I am not the same person anymore. And that's a cue in. It also could be things that are losing hair, starting to gain weight in the midsection. People will say, I'm eating the same, I'm exercising the same, nothing is different, but I'm gaining weight. It can be frozen shoulder. It can be a whole long list of 30, 40, 50 symptoms that are so commonly misdiagnosed as something else.
And you and I frequently see this, right? And it's easy as a practitioner when someone comes into your office and initially they say, I don't feel good. We try not to get that tunnel vision, right? Or that diagnostic anchoring where you think it's something right away. But you can see where if someone comes in and says, I don't feel right, I have brain fog. Well, you're like, do you have stress at home? Are you anxious? Are you depressed? These types of things get brought up all the time, when in fact, especially with women, we should be like, should we check estrogen levels, progesterone levels? Can you speak to a little bit of some tests that you should do when someone comes in and they're saying some key things that are like, oh, this may be perimenopause?
Yeah, that's a great point, because our estrogen and progesterone levels do not tell us if we're in perimenopause. So thank you for bringing that up. Those hormone levels fluctuate constantly, daily, and they are not indicative. We need to listen to our patient and go off of their symptoms. With that said, we should be checking thyroid. We should be checking vitamin D. We should be checking other things and ruling things out, because it could be something else and
Sure.
it's not perimenopause. So we want to make sure of that too.
Yeah. So a lot of it is getting just a very comprehensive history, really sitting down and listening to people. So if you think somebody has perimenopause, you're going to do some laboratory studies to make sure it's not thyroid, make sure it's not vitamin D or B12 deficiency or some of these things that can creep up. If you diagnose perimenopause, what are you telling your patients that they should really focus on to be healthy in that stage?
Yeah, so as far as medication-wise, it is talking about adding estrogen in.
Perfect.
And if they need contraception, that could be a low-dose birth control pill. It could just be an estrogen patch, just a little something to level out those hormones instead of the erraticness. And it's trial and error. We have a whole menu that we can look at what's going to work best for this patient. And let's try this. If it works, great. If it works sort of, well, maybe we need a little more, a little less, whatever the situation may be. Maybe we need to add in some progesterone. Maybe we just start with progesterone. It really is based individually on what are the symptoms, what are the goals, what are they comfortable with, and go from there.
And then you have this same patient that maybe you give some birth control, some estrogen, some progesterone. Once they start transitioning into menopause, that just brings on a whole nother types of symptoms, or what happens when you transition from perimenopause to menopause, and then what do we have to look at for health in that stage?
Yeah, great question. If we have the hormones dosed right, they may not know.
Okay.
Aside from no longer having a period. That may be the only, but they may not have symptoms. We may have just eased right into that transition without that erratic, without all these other symptoms that come into play.
Okay.
Yeah.
Okay. And then when does menopause usually hit? Like, when are you in full menopause, or how long can perimenopause even last? We can tell our viewers what they can kind of expect for that as well.
It's all over the map.
It's all over the map.
And ethnicity gauges that a little bit too, but average in our country is 51 years of age.
Okay.
And some go, that's an average, so some go late into their 50s. They're still having some type of a menstrual bleed. So if there's a bleed that happens 6 months ago and then get a period today, well, then now you have to look a whole nother year out before you hit menopause.
Gotcha.
So that you don't know what that's going to be until you've gone a full year.
Okay. And then once you hit that full year and you go into menopause, what types of women health issues happen in that stage? What do we have to be looking for? What do we have to be doing at that stage?
Ideally, we're looking at that ahead with some of the things we talked about in the earlier part of the show.
Yeah.
Doing the DEXA scan, looking at that bone situation, cardiovascular, looking at lipids and apolipoprotein A, or evaluation and lipoprotein A, and looking at the things that are longevity for cardiovascular disease, looking at the hemoglobin A1C. So we're seeing, is there prediabetes coming in? Those metabolic changes naturally happen as we lose our estrogen.
Estrogen levels, right?
So we want to be watching those, catching that ahead of time, and then adjusting what's our diet, exercise, lifestyle plan. What can we be doing? What are we in control of? Do we need to be referring out to other specialists? Is this something that we're going to see come back down into normal range if the patient chooses to use some estrogen?
Use some estrogen, sure.
Yeah.
Can you speak a little bit, you don't have to go too deep into it, but just tell our viewers a little bit about, there was a lot of talk about hormonal replacement being just awful for women, right? And that mindset and that data was based off of really old studies. And so now the new research tells us what?
Yeah, the Women's Health Initiative from 2002, that's what broke early before the studies were even done. And the media got a hold of that information, and it has been well shown to have not been accurate information. That's where the very big fear of breast cancer tied to estrogen use came from. That has been proven many times over to not have been the case. And if that had been the case, we had been prescribing estrogen for women decades before that. We would have seen those same answers.
Okay.
So yeah, in 2002, it went from 50% of women taking hormone replacement down to 4% overnight.
Oh, wow.
And people stopped prescribing, not taught in med schools. Still today, very few med schools have any menopause education. So finding providers that know how to do this and are willing to do this and can talk about not only the risks of taking it, but the risks of not taking it.
Yeah.
It's just as important for women to know. If you choose not to, absolutely fine, but you may go down the paths of more dementia, more cardiovascular disease, all kinds of other things, where women, I think, oftentimes think breast cancer is our number one killer, and actually heart disease, which I'm sure
Is the number one, yes.
you're well aware of that. Yeah, 7 times greater risk of heart disease than breast cancer.
Mm-hmm. I'm glad you brought up diet and exercise, because I want to tell our viewers that eating a well-balanced diet is absolutely key, but also exercise, moving around is going to keep our bones healthy because you're putting, strain on them so they actually build. So diet and exercise, in your opinion, is super important as well,
Absolutely.
right? Okay.
Yep.
So with women's health and hormone replacement, we can let our viewers know that if done appropriately, it can be safe and effective.
100%.
Awesome.
Yes.
Thank you, Sue, for being on today.
Thank you for having me.
Yes. I want to thank all of our viewers for watching this episode of the Clinical Compass as well. Please stick around for the credits, where I will do a before you go exercise tip. Hello, everyone. Before you go, remember, motion is lotion. Exercise is preventative medicine. The best way to achieve this is to go outdoors and walk for 10 to 15 minutes. If you cannot do that, you can simply walk inside your home. If walking around inside your home is not feasible, you can use things like soup cans or light weights to do exercises for upper body strength, to work your biceps and different muscle groups.